Good afternoon, good evening, everyone. Merry Christmas to us all. Still in the season of Christmas, I want to talk quickly on what is called Christmas disease. So, um, what is Christmas disease? Christmas disease is also known as hemophilia B. It's a rare genetic bleeding disorder caused by deficiency of a clotting factor 9. So, and this it leads to prolonged bleeding and injuries, e.g., bruise and spontaneous internal bleeds, especially in joints, and is managed by the factor 9 clotting factor replacement medications. And this disease was named after the first patient who had it, Christmas Stephen, in 1952. So, what is the cause? It is actually caused by a mutation, a change in the gene of the X chromosome affecting this factor 9. It is also linked with recessive disorder, and it primarily affects males majorly and is passed down to the mother, so it is majorly inherited. So the next thing is, what are the symptoms? Excessive bleeding from minor cuts or injuries, easy bruising, bleeding into joints, blood or urine in stool, prolonged bleeding after surgery, dental work or circumcision, and spontaneous nosebleeds. How do we diagnose this infection? Diagnosis through symptoms and blood tests show low clotting factor 9 level, and it has level. We have the mid level, we have the moderate, and the severe one. Those are for those in the MLT department. Now, for the treatment, the replacement of this factor 9 blood clotting 9 replacement. We also have medications and drugs that have been used, gene therapy, prophylaxis, majorly by infusions to prevent bleeding. So what happens to the patient with Christmas disease? So there are prolonged bleeding from nose, majorly outer bleedings that should not be long, get longer than they use. What are the primary treatment? The drugs. We as pharmacy technician, the replacement of the factor 9 concentrates. So the main treatments are these, and these drugs affect the DNA structure of the person in treatment, and these are the name of the drugs. Their brand names are what are here majorly: Aprolix, Benefis, Advion, Ixinity, Monomin, Rebinin, and Rexubis. I have the pictures of the drugs. They are majorly infusions. Like this Edevion, now we have both infusion and tablets. So, but these ones majorly are majorly infusions to face this factor 9. Then, what are the adjunct drugs? The adjunct drugs added to these, the first part of the drug I mentioned, there are many, but we have the major ones: antifibrinolytics. These medications help to prevent existing blood clots. An example is the tranexamic acid, we all know, and the aminocaproic acid. There are many other drugs. So, but I'm skipping it because of the slide. Now, medications to avoid. People with hemophilia B should avoid non-steroidal NSAID. They should avoid NSAID. Drugs that can worsen bleeding problems and blood thinners or anticoagulants such as heparin and warfarin. In conclusion, if you know someone who have Christmas disease, it is recommended for the person to go to the hospital or see an hematologist for proper hemophilia treatment. Thank you. Merry Christmas to you. God bless you.